Hello everyone, I am Dr.Devamani Pandiyan, a gynecologist and in charge of ARC Vellore branch. I have completed my Masters in Obstetrics and Gynecology and also a special Masters in Assisted Reproductive Technology from the University of Nottingham, UK. I have got several years of experience in the management of infertility, and that's my passion to treat couples with infertility and help our fellow people. I was asked, what is IUI? IUI is intrauterine insemination, which is a very basic treatment for subfertile couples. When we talk about infertility, there are several problems encountered by these infertile couples in our society. So we in ARC start not only straight away with a higher treatment like IVF or ICSI, but we do IUI, which is a very basic treatment. When we talk about IUI, we have to investigate the couple and see if they will fall within the criteria recommended for intrauterine insemination. So who are these couples who are fit for IUI? First of all, we think of their age and the number of years of marriage, see their ovarian reserve by ultrasound to see if they have enough number of eggs, and also most importantly, the semen quality and quantity. There is a certain WHO criteria that says that only if the man has a certain quantity of sperms, then they can be taken to the IUI program. So very careful patient selection is important to take the patient for IUI. So that is one thing that ARC concentrates a lot on, which is very different from other fertility centers. We try to manage the couple with more IUI treatments so that patient doesn't have to go for a very high treatment when they can get pregnant with a smaller treatment. So when do we do IUI? IUI, as I told you, after careful patient selection, seeing their ovary and checking their AFC, which is the antral follicle count, and also the semen quality. We also do something called a HSG, which is to see the shape and the size of the uterus and also the patency of both the tubes. So only if the tubes are patent on both the sides, we tell them that the success rates of IUI would be high, because we cannot do IUI for blocked tubes. Secondly, we go on for the ovulation induction required for IUI treatment. So IUI is done by inducing the ovary. We have to induce and get more eggs for IUI. When we give injections and medicines to get more eggs, and then patiently and carefully monitor these follicles growing, and finally give a proper trigger, we subject the patient to IUI. And what makes ARC a little more different is that we do double insemination. For the same cost, we do double insemination so that the probability of pregnancy is increased when we finish our IUI cycle. And we are very proud to say that we have almost 80% success rates in IUI itself. Only when we have a failure in IUI of more than 2 or 3 cycles, we even think about explaining about IVF to these couples.